Thank you so much for joining us today. I am thrilled to welcome back to Bennington, virtually, of course, Dr. Jennifer Mieres, class of 1982. Dr. Mieres is a cardiologist, an advocate for equity in healthcare, an author, and a documentary film producer. Her extraordinary career fuses medicine, education, and activism, and it truly embodies the Bennington spirit. I think you'll find her conversation with Sunny Guo fascinating. Sunny is a post-baccalaureate pre-medical student at Bennington. I'm honored today to present Dr. Mieres with this year's Elizabeth Coleman Visionary Leadership Award. This award was established by the parents of a Bennington alum in honor of Liz Coleman's 25-year presidency. It recognizes an individual from the college's network whose inspirational leadership has advanced civic or cultural life, and in doing so, has improved the lives of others. The award is in its 7th year. Some of you may remember that the inaugural winner was the late Holly Block of the Bronx Museum, who was beloved in the Bennington community. This award celebrates the achievements that get right to the heart of what we value here at Bennington. The recipients demonstrate not only exceptional sustained commitment to their vocation, but also a profound belief in the power of individuals to effect change. Few embody this spirit of ingenuity with such tireless passion as Dr. Jennifer Mieres, our 2020 Elizabeth Coleman Visionary Leadership Award winner. As her classmate Shamala Dyson noted in her nomination letter, Jennifer has, as a Black woman arriving as a foreign student, navigated all the race and gender barriers to develop an eminent career. Her range of talents, the lighthearted but focused way she approaches challenges, as if, of course, one is meant to be able to do anything one puts one's mind to, is something I always felt was very central to Bennington. She was remarkable as a fellow student for her humor, her intelligence, and her perseverance. Jenny's socks and sweaters always matched. Her mind was always clear. She always carried a heavy academic load, and yet was always an available and substantial friend. Dr. Mieres' CV attests that those qualities haven't changed and that she has used her gifts and talents to the benefits of others. A lovely tribute from a classmate. In my short time at Bennington, I've had the opportunity to get to know Jennifer. She's the co-chair of the President's Working Group on Diversity, Equity, and Inclusion, and I am so thrilled to honor her here with this award. She is passionate, positive, smart as a whip, and a truly wonderful and caring human being. Before we get into the conversation, I'd like to tell you a little bit more about Jennifer's life and work. Jennifer arrived at Bennington in the fall of 1978 from Trinidad. Though her studies concentrated primarily in physical sciences, she also took dance, writing, and other humanities classes. She went on to study medicine at Boston University, where she found her Bennington education had prepared her well to ask the why, to look for solutions through ambiguity, and to dedicate herself to equity and service. As she says, Bennington has taught her to always find a way. Jennifer's clinical work and research focus on the elimination of health and gender disparities, and she's a leading expert on cardiovascular disease in women. On top of that, she is Northwell Health's first Chief Diversity and Inclusion Officer, and she leads Northwell's Center for Equity of Care, which is dedicated to eliminating disparities in the delivery of healthcare to the community. Jennifer is a prolific communicator. She's the co-author of Heart Smart for Women, 6 Steps in 6 Weeks to Heart Healthy Living. She's an executive producer of the women's health documentary Misdiagnosed and several other documentaries. Jennifer, of course, is a recipient of many prestigious awards, and today I'm delighted to add another one. Like Shamala and the selection committee, I find Jennifer's life's work to be so inspiring, and I look forward to hearing her conversation with Sunny. Congratulations again, Jennifer, on this honor, and thank you so much for bringing your visionary leadership to the world.
Well, I'm super honored to be here speaking with you and kind of like hosting the Q&A. I'm really impressed by all of the work that I've seen that you've done, and this Elizabeth Coleman Award is for a distinguished leader, and I see that you're like super involved with what's new in cardiology and wellness. So I always like to hear about people's backstories. Like, I'm really curious about your time at Bennington and how that shaped you into the cardiologist that you are today.
Well, a pleasure to meet you and happy to hear you're pursuing medicine, which definitely, has been my passion. And I'd just give you a little bit of background. I was born and raised in Trinidad, my early years, wanted to become a doctor since age 7 because I lost my grandfather when I was 7 years old. I was very close to him, my paternal grandfather. He died of a heart attack. And as a 7 year old, I couldn't understand why, he had to die, why he had to leave us. And so I made a pledge at age 7 to go into medicine and specifically interested in cardiology. And, I sort of stumbled upon Bennington because Trinidad was part of the British Commonwealth. A lot of my colleagues were going to school in Canada. My siblings went to school in Canada, in Canada or England. And I had read an article about Bennington and the fact that it was sort of, was a place that you could go to still study the sciences. And coming from Trinidad, a small country, it appealed to me. I like the fact that you could sort of co-create your education. I like the size, and ended up going to Bennington. And it was fascinating because I think it helped create the person that I am today. It sparked curiosity. The small classrooms made for, intimate discussions and interactions with your professors. It really made me, I would say, much more of a global thinker and looking at things, and finding solutions from a much more global perspective. And so I would say Bennington helped me, especially now, decades later, I'm still sort of pulling on my Bennington experience. It's sort of subliminal, right? To tap into creativity, to learn how to communicate. And truly the curiosity that sparked, I approach problems with sort of a Bennington way of thinking, saying, oh my gosh, let's look at this from a different viewpoint. How could we solve for this? So at the time, it didn't seem that it had such an impact, but decades later, I'm pulling on the fact that Bennington helped me to be creative, helped me to be much more of a global thinker, helped really spark my intellectual curiosity and to be solution oriented.
Yeah, I'm definitely seeing the creativity. I mean, you're a documentarian, you're an author, and you've really done a lot of different things and like spread your message in different ways in media that are not just they're just not so traditional. And I think that Bennington has had a part in that. And I heard that you were a dancer. And what did you study in Bennington?
So you have to understand, the British system is very sort of traditional, right? You sort of declare your major. So in high school, I was a science major, but also played, was an athlete as well. I played field hockey and did track. At Bennington, I still was science and sort of art, science oriented, right? So I did a lot of studying with Betsy Sherman, biology, physics, quantum physics. But because Bennington is such a place that you can't just be one track, right? You couldn't be, just study science. I actually, did a little bit of everything. So dance was something. I just did one dance class really because I just wanted to explore, but studied poetry, played the piano, and did other things, as well as, played soccer on the sort of co-ed soccer team for fun. But my major was really more science than everything, but I sampled a lot of the arts, which I think I am now, as I go through, my life as a cardiologist, as a doctor, using that tapping in to what I learned at Bennington.
Yeah, I'm definitely seeing that. And I also think that a lot of the students that I've met at Bennington are also like they do something like they do totally different that major or not even majors, I guess like they don't even call it majors here. It's more like they do different concentrations of study that you wouldn't expect to see together. And that's one of the things that I thought was really amazing when I was like reading all of your accomplishments, like when I saw that you're like an author. And could you just talk about some of the work that you've done and like what are you most proud of?
So, I think, coming back to Bennington, when I was there decades ago, I hate to say, there was a large international student contingencies. So we learn from each other. I think, you become a lifelong learner. You start looking at things with a different viewpoint, right? And I would say, and that Bennington, so going into medicine, so I left Bennington, went to BU for medical school. Betsy Sherman actually was one of my sort of heroes at Bennington. We worked closely together. And follow the traditional pathway of going into medical school. And what you said is so correct, that Bennington fosters not only the curiosity intellectually, spiritually, but also definitely sort of fosters that, the creativity and the ability to do things differently. So you have sort of this thinking of co-creating different paradigms, different algorithms to approach problems. So going fast forward, I went to BU for medical school, pretty traditional, still set on, sort of becoming a cardiologist, meeting mentors there, like Alice Jacobs, who sort of became one of my role models. And then cardiology and medicine is pretty traditional. You follow the script. There's not much time to do a whole other else, right? I mean, I probably did, picked up skiing, which I had started to do a little bit in Bennington. And of course, coming from Trinidad, there's no snow. So that was like my one sort of activity. And then going to, after training at St. Luke's, which is now Mount Sinai West, really looking at, oh my gosh, what am I going to do? Am I going to follow the traditional way, going to practice, and see patients where you touch lives, very, very important? Or am I going to sort of find a way to really change policies, change lives, just instead of touching one life at a time, the ability to create policies and look at healthcare differently. And of course, I became very focused on the sort of gender disparities in cardiovascular care. So, you go to medical school, it's 4 years, 3 years training in internal medicine, then 3 years training in cardiology. And I met one of my mentors, Judy Hockman, who was a researcher, clinical cardiologist researcher, looking at how we started to look at how men and women were coming in with heart attacks, but the women came in later and therefore were not eligible for the life-saving strategies we had at that time. And at that time, it was the lytic agents, how somebody's coming in with a heart attack, how you dissolve the clot and abort the heart attack. And we recognized that there were indeed, sex and gender disparities. Women were coming in later, not eligible for life-saving strategies. And as a result of that, many more women died, didn't leave the hospital where men went home, as well as had many more complications. We would see female patients in my cardiology clinic, and they had heart failure and many, many more complications. And that really sparked my interest in looking at doing some research to understand what the sex and gender differences were in cardiovascular disease. And so I would tap into my Bennington way of curiosity and really global thinking, and starting to think about how could we transform, healthcare and the delivery of cardiovascular care. And, you fast forward to my first job at North Shore University Hospital, thinking about designing research studies. And we designed a study to look at what were the signs for women coming in with heart disease. I became a cardiovascular imager, a nuclear cardiologist. So how could we image women to find heart disease much earlier? And that sparked to an international trial, the Women Trial, the only trial of its kind, where I had collaborations with people from across the country, Dr. Leslie Shaw from Emory, Dr. Gary Heller from Hartford, Dr. Bob Hendel from Miami, and we designed this study to look at how women were presenting with heart attacks and how we should image to find heart disease. So I tap into that, the creativity, the curiosity, and thinking much more globally into, I attribute my Bennington platform for sort of sparking that curiosity. But I think in addition to that, I think where the Bennington creativity and the Bennington ability to transform and to come up with new solutions come into effect really has to do with, becoming an author and becoming a documentarian. And in thinking about how do we empower people to be partners in their health, right? Because you meet, and I would, sort of transform my focus to focus a lot on women's cardiovascular health. And one day I met a patient, Barbara Paskoff, and she was a documentarian and a little bit irreverent, but she challenged the whole team and challenged me to say, you guys in healthcare are, women's health and women's cardiovascular health leading cause of death. Why don't we do something about it? And she said, you write in your journals, you write in your peer-reviewed journals, and you speak a language that the average person doesn't understand. And yes, science is advancing, but you are not translating the science into actionable items for the average person. And she said communication is so important. And that also, helped me spark my interest with my colleagues. How could we empower? What are the tools needed to empower women to be partners in their health? And Barbara said to me, let's make a documentary, right? Everybody has a TV. The power of storytelling is so important. So that sort of sparked, my first getting involved in uncharted territory, and expanding the healthcare platform to make a difference. And so we got together, we got people from all across the country, luminaries, women shared their stories. The person who was the Connie Burt, who worked in or as a receptionist checking in people for their stress test, had her own sort of near, brush with heart disease, and volunteered and told her story and became one of our stars on the movie A Woman's Heart. But it was interesting because, it was a whole new area, but we touched so many lives and sort of created a movement, and using the power of storytelling to empower women to be partners in their heart health. And then at the same time, I became a volunteer for the American Heart Association. So, volunteering and helping craft and create, being one of the early people involved with the Go Red for Women campaign. And again, using the power of storytelling to get women to realize that, they're at risk for heart disease, it's preventable, and your health is your most important asset. And then, tapping into the science of Go Red to say we need to write guidelines, we need to sort of expand the platform and become health literate in how we convey information. So again, I see the Bennington way there of like creativity, the power of storytelling, tapping into filmmaking, which was a whole, oh my gosh, new experience, important. And then writing a book also inspired by Connie Burt to really give health literate, easily accessible information.
That's so fantastic. Oh, sorry about that. I'm just curious to know, like, if you were able to deliver, I guess, like a one-liner message to all women, why is cardiovascular disease so prevalent in women? Why did they come in later? And like you said, weren't able to implement these life-saving strategies on them? Like, what was the reason behind that?
Well, I think, it has to do with our society and how we, in the science community, the medical community, studied heart disease and extrapolated protocols and research that worked in men onto women. So if you go back into the decades in terms of research, a lot of our research comes from basic science, right? Understanding that cardiovascular disease, there are many components, it's an inflammatory disease. We studied, our scientists worked on male mice. Female mice were much more challenging to work on because, there's the whole menstrual cycle, it interrupted, whatever. And we as females have estrogens and progesterone. So they chose the simple path of studying cardiovascular disease, the treatment strategies, the whole process, and then extrapolated that this was the model, it was a male model, and what worked in men will work in women, completely ignoring the fact that estrogen, progesterone affect the vascular system differently. And so research that worked on men, we recognize in about the late 1990s when Bernadine Healy and Dr. Nanette Wenger, and Dr. Nanette Wenger is still a prominent cardiovascular disease luminary today, spearheaded women's cardiovascular research and started looking at the fact that women were coming in later because of symptoms maybe a little bit more diffuse and not fit into what we describe the textbook classic description, right? So if you don't recognize that the spectrum of symptoms for heart disease can include sort of nausea as the first symptoms, neck pain, back pain, feeling of gloom and doom on all of these, then you're going to not recognize until it's too late. So we recognize that symptoms may be much more diffuse and a broader spectrum of symptoms. We also recognize, and work done by Dr. Noel Barry Mieres at Cedars-Sinai from the WISE trial, that that cardiovascular disease in women, especially cardiovascular heart disease, there's a spectrum. It's not the classic just blockage, that we have not only, blockages, which show up especially in postmenopausal women who behave a little bit more like men when we've lost our estrogen, but also that in younger women, you can have disease affecting the endothelium, so the lining of the blood vessels, much more prominent in women, and then the smaller vessels, also contributing to cardiovascular disease. Pregnancy-related complications can lead to heart disease much earlier in women than men. We also know that spontaneous coronary artery dissection, so it's sort of a tearing away of the line of the blood vessel, happens in women under-recognized. So truly, because we have followed a male model, women's symptoms were under-recognized, undertreated, resulting in higher, death rates and complications from a disease that is 80% preventable.
It seems like to me, as with most things, it's just 10 times harder as a woman.
It really is.
When it comes to disease as well. Yeah, so I'm really curious to hear more about your adventure as a woman in healthcare, what kind of things you had to overcome, especially as an advocate for women's health, especially.
So, and I just wrote about this for the Women in Cardiology section of the American College of Cardiology. So I'll share it with you. And I wrote about finding my joie de vivre. I think that, and as I communicated in that article, my family values, my family values laid the foundation for who I am and how I navigate the world, right? And as a young, teenager growing up with my family, my mom was a school teacher. My dad went back to law school, became a judge, and I have two younger siblings. And we were a tight-knit family with my grandmother and aunts. We really believed in giving back, right? So we lived in a small town and people came to see my dad at all hours of the day and night. And we always had sort of an open house, willing to help each other. So making a difference in the world and not just occupying space, as my grandmother used to say, was important to me. We learned that that you can learn something from every single person, and at every situation there was something to be learned. So lifelong learning, and then finding a way to navigate around was also important, without, of course, losing your integrity, but also that we are all connected as human beings, and that you will find obstacles, but you have to learn how to find common ground and connect with people. So building a network of friends, colleagues, mentors across the spectrum in every place that you get. And I saw my father do this very well. He had friends of all different walks of life. And you connected, the human connectivity was important. And so sort of drawing on those sort of foundational skills of giving back, building a network, seeing people, finding ways to connect, even though there are obstacles in the way, have really, and being a lifelong learner, learning from everyone has something to contribute, laid the foundation for navigating a challenging space of being a woman in cardiology, being a Black woman in medicine, and really finding ways to find commonality to connect with people, shared mission, shared vision. And you know, finding the people you can always find. I think it's hard to build friendships sometimes because we look at difference and we say, oh my gosh, you know, you sort of pull up your defensive, you're afraid this person is coming to take my spot. But trying to, it's hard, it's much harder, but building that network, finding shared vision. And you'd find when you communicate your shared vision, and it comes back to the power of storytelling, right, that people suddenly recognize, and they want to help, they want to give. And so that has been sort of my way of building a network, building friends, sharing visions, storytelling, to sort of navigate. And it taps in again to the Bennington way, right, of storytelling, of shared vision, shared interests, shared commonality, right, but also embracing difference, right? And you get people to say, oh my gosh, you know, we all have biases, we all have sort of things that have been, you know, a lived experience that shape how we see the world, and being open to look at things or different cultures, different people, and recognizing we have a lot to learn. And it goes across generations, across genders, right? The whole sort of reverse mentorship, right? Learning from people from a different generation, different culture, you giving back, and shared information has sort of been my foundational pillars for navigating the world of medicine and the world of healthcare.
That's super inspirational. Yeah, I think in healthcare, it's especially really important to recognize that there's differences, but also to grow from those differences, and so that you can help more people, and that you're not looking at anyone in a biased manner, and that you're providing the care. And I'm sure that you are, and you're really spreading the message to a lot of different people, which I think is very impressive and important. So where do you see areas for like improvement? Have you seen areas of improvement in your lifetime as a cardiologist?
Well, you know, when, you know, so you go back to my grandfather's story, right? You know, and when we questioned my grandmother, you know, he had symptoms, ignored them, right? And of course had the catastrophic heart attack, and nothing could be done. You know, and that dates back to like 1967. And you fast forward to my time training in cardiology, and even fast forward to now, we have great technology. We understand a lot more about heart disease. We understand the sex and gender differences of heart disease. That's still an area of exploration because we're decades behind. But we know that people don't have to die from a heart attack. And if you look at the American Heart Association statistics, you go back to 1979, right, where more women died than men up until 2013. And now the curves are changing. But we understand the risk factors for heart disease. We know it's inflammatory. We know how to control risk factors, you know, cholesterol, we know statins, we know high blood pressure, which is prevalent, especially for women as we get older, you know, just the vascular changes. We know how to detect, to image, and to treat. And we know how to abort a heart attack with stents, with coronary artery bypass surgery. So a lot of changes in technology and pharmacology over the past, you know, I would say 4 decades. And people are living much longer. The challenges I see, and where a lot of work still needs to be done, again, in understanding the sex, all aspects of the sex and gender differences. Some of the, so I think we also need to, where we need to work is in empowering people to recognize their health as their most important asset and focus on preventive measures. I think that our narrative and people's attitudes towards health is sort of, you know, still focused on the acute, right? The acute setting. You know, you go to your doctor, if you happen to go for a yearly checkup, and he or she, you know, goes through, you know, check your blood pressure, weight, the whole shebang, and you remain sort of the silent partner, right? You don't and you hope, and the thinking is, I mean, and I'm guilty of this at times, if I'm feeling fine and there's nothing found in that visit, I'm fine, right? So trying to get people to recognize prevention is such an important piece for many diseases, right? So we're dealing with an epidemic of chronic disease. Heart disease is a chronic disease, can be prevented. Cancer, look at the progress in cancer treatment, is a chronic disease. Diabetes, a chronic disease, hypertension, stroke, a chronic disease, renal disease. But a lot of this can be prevented. So that is the hard part, right? The prevention piece, because it means that you have to be a partner in your health. You can no longer be passive. And I used to say when I practice, I would say to my patients, you're going to see your accountant, it's tax time. How do you prepare for that accountant's visit? You don't show up empty-handed and hope to get a refund, right? You have to get your receipts, you have to get stuff. Well, I think we need to look at our health the same way. So in preparing for your doctor's visit, keeping a log of what has happened over the past year or the past month and writing it down, because I always believe unless it's written, we forget, right? Looking at your family history, what happened in the family? Was there hypertension? And I'm focusing on heart disease. Did mom and dad or the siblings have heart diseases in early age? Because we know family history and the genetics predisposed to how we will navigate the healthcare space and what will happen to us. So truly, really embracing the fact that you are a partner in your health. It is your greatest asset. And you have to be an active participant, right? Because 50% of health outcomes or 80% of health outcomes depend on everything other than the medical encounter, right? The 50-50 partnership is that you have to go in with information. We as physicians don't have ESP, right? The history is only as good as what you're telling. And the history tells, storytelling tells a tale of how we come up with a diagnosis is important. So I think the hard part is, yes, technology needs to continue, and we're moving into precision medicine, genetically predisposed, but we as patients, as people, need to understand that we have to be active participants and partners in our health. And the simple things like in heart disease, lifestyle changes, a huge piece. So hard to do, right? So hard to, if I had to say, and I would say, as we wrote in our book, Heart Smart for women, 6 steps in 6 weeks, choosing to move every day, the power of exercise. If we could turn exercise into a pill and give it to everyone, we would. A diet or eating lots of fruits and vegetables or plant-based if you can. Sleep, so important, right? As well as definitely controlling stress. So choosing to move, if I had to say one thing, choosing to move every day, truly, truly important. And we simplify it. It doesn't have to be, you don't have to join a gym. Walking briskly, dancing, cycling, swimming, whatever you need to do, 150 minutes of activity every day goes a long way. 150 minutes every week goes a long way to the journey to heart healthy living.
Yes, it's definitely very important. And I think actually nowadays there's this kind of wellness trend that's going around, and people are a lot more aware about, not only just consumption, but also about how to take care of themselves, how to prevent themselves from, having to visit a doctor when it's already too late to do anything. So I think it's definitely really good that we're going in that step. And I think digitally, that's also been very helpful. And like you said, storytelling, there's a lot of media around everything. And I think most people know by now that exercise is super key.
Yes.
Yes, definitely.
Well, and you're right, the digital piece. I mean, my Apple Watch keeps me on tabs. And, you don't have to have an Apple Watch, but a Fitbit or something, or even your phone to say, oh my gosh, at the end of the day, if I have been sitting all day or I see that I've only walked 3,000 steps, it's like, oh my goodness, I gotta do something, right? And even if it's walking up and down my apartment or going out for a quick walk, important.
Yes. I guess it's like harder. I used to work in an office, so it was really hard for me to, find the time to get up and walk around, usually just for like bathroom breaks or, getting a coffee or something. But I mean, what would I think your life isn't super sedentary because you're probably up and about a lot, but what would you say to those people who, especially now, we're always indoors and don't really get to see people or go outside?
So, I think the good thing and what we learned from the American Heart Association and part of their, the science piece of their Go Red for Women campaign is that you don't have to get your 30 minutes of exercise all in one block. So that if you could get a 10-minute interval, right? If you could walk for 10 minutes, it's the cumulative effect, right? So I think it's important that we, especially as we're tuned into Zoom and we're all working from home and remotely, that we walk around, that we don't sit all the time. And you catch the 5 minutes or the 10 minutes whenever you can, taking the stairs, just even walking around your apartment or your house, it's important. I also think it's important, and we wrote this in our book, finding a partner, doing a challenge, right? Making it a family affair or challenging a friend to join you on that journey to making sure you get 150 active minutes per week. So the competitive nature, definitely important. And we also know standing, sitting, someone said, one of my colleagues, sitting is like smoking cigarettes or whatever. And we know smoking cigarettes is awful. So finding time to get up, and your watch or your digital device can sort of say you've been sitting too long. So making sure we stand, and even if you're watching television or on the Zoom call, a little bit hard to do if you're concerned about the aesthetics, a standing desk, getting up and walking around, so truly being more active, I think it's definitely important. And, when we think of ways to sort of empower us all to be partners in our health and to be on the journey to health and wellness, first of all, small steps make a difference. Sometimes we'll go off the wagon, especially now confined, eating could be a stress reducer. It's never too late to sort of get back on track. And I'm a big believer that we should have health and wellness as part of the core curriculum starting in kindergarten. Math and English and history and geography, all of these are key components, but health and wellness should really be, we should start learning about the body, about preventive measures from high school. And I would advocate to put health and wellness as a core curriculum, that every person graduating from high school understands how the body works, understands what they need to do to prevent and control chronic diseases. And it should be mandatory, just like we have to learn math, English, geography. Who needs to learn geography, right? When health and wellness is much more important. That's how I look at it. So we have to advocate and go on a campaign to change the school curriculum or the core curriculum, beginning in kindergarten, to include health and wellness.
I think so too. It's super important to have these thoughts like ingrained when you're younger, because when you get older, it's harder to change like certain lifestyle things that you've always grown up like with, like eating sugar all the time and, having unhealthy, nobody really tells you what's good. I mean,
Right.
like, I grew up with a single mother, so I'm just used to eating like whatever is in the fridge when she was working. So nobody ever really taught me. But I think it's better now because we're in this digital age and everyone has access to like knowledge as long as they look for it. So I think that's one of the good things about what's happening now. So I think we've talked a lot about like women in cardiology, like cardiovascular diseases. Could you talk to me a little bit about some of the diversity challenges that you faced in your lifetime? I mean, being a Black woman in cardiology, how was that for you? What kind of challenges that you faced, especially since right now it's a little bit better, but like back then when you were starting out, I mean, a lot of issues.
It was a lot of, challenges. So, so I go back to, Trinidad, growing up in Trinidad, which is a multicultural society. It was sort of, education was your key sort of currency, right, to having a better life. And so there was not sort of racism per se as we see in the United States. So I grew up in a country where I was, part of the majority. It was a country where education was key. Everybody sort of was part of the community, and whether or not you went to college or not, you wanted to find something that you could make a living, right, and become autonomous. So coming to Bennington was sort of a little bit of a culture shock, but because there was such an international student body, I found my niche and fit in, and we shared ideas with people from all over the world. Going to Boston for medical school, now there was where was really sort of the sort of stark reality that, I was a person of color, I was Black, and that there were all these sort of nuances and dynamics, and truly dealing with patients' prejudices, um, as a woman being called, thinking I was the nurse, or having to bring somebody in food services, just made me, and then microaggressions, some racial slurs. And so, you name it, you experience it, right? And just also not having your voice heard, people talking over you, led to a lot of insecurities, some insecurities in terms of imposter syndrome, thinking I shouldn't be there. And I'll tell you what really helped to carry me through was really the foundation built by my parents. Seeing myself, my parents always said, see yourself as a citizen of the world, be a global thinker, and then pulling on some of, I would go back to Bennington, finding a way to connect with people and sort of show them that we're all connected and that I can bring something to the table. But I'll tell you, it was so emotionally draining and burdensome, right? And sort of realizing that to be confrontational and would deter and detract from my personal agenda. So staying focused on what I wanted to accomplish in the world, having a bigger platform, meant sometimes just sort of stifling the slurs, the racial aggression, and staying focused on where I wanted to be and not becoming distracted. So a lot of reflection, a lot of, my family being very supportive, and building that network of friends and family that you could talk to about these things was definitely important. And truly the diversification of my friends to include people from all different walks of life definitely helped, because you could share stories and they'll say, yeah, that happened. But truly staying focused to get back on track was really what got me through. And even, today, there are still challenges, but I feel that I am, focused with my friends, my colleagues, in building this sort of raft that we can help each other and reconnect as human beings. But there is no question, it's not easy. It's not for the faint of heart, but a network of friends being sort of mindful, recognizing what's happening, and talking about it, and finding ways to sort of diffuse or mitigate some of the challenges. It's important. It's a huge, it's emotionally draining at times, no two ways about it. And there are some days I'm like, oh my gosh, I cannot do this. I want to run away, but then my friends, my colleagues, it's like, okay, we've got this. So truly important. And and as you think of healthcare today, right? So I always go back to say, and this comes from some of my Bennington professors and teaching, finding the why. If you could find the why of something in terms of communicating the why we need a healthcare system that includes the tenets of cultural competency, language access, health literacy, the tenets of diversity and inclusion. Why do we need that? Why does healthcare have to expand its platform? The why has to do with the fact that all of our technology, all of our advances in medicine have led us to dealing with the 21st century problem of the epidemic of chronic diseases. The epidemic of chronic diseases, as mentioned, hypertension, heart disease, cancer, means that we need to include all of the things, all of the determinants of health, right? And so the population health gurus have shown us that 80% of health outcomes depends on everything other than the medical encounter. We in healthcare account for 20% of outcomes. We write prescriptions, we deal with acute problems, and we say, go out and exercise, healthy diet, take your medication. And we don't recognize that not everybody has access and can afford the medication. Not everybody has access to a path where they can exercise, or that they even understand what contributes exercise. Not everybody has access, we all speak in English, to understanding that someone's preferred language, what they speak at home, is how we should communicate, right? So the power of communication, the power of shared decision making. Not everybody has access, and I found this out, to a sort of fresh fruits and vegetables. So incorporating all of those things that affect health outcomes has to be a why, an expanded platform for healthcare delivery if we are to control the epidemic of chronic diseases. So there is a fundamental scientific reason why we need to include the tenets of diversity, why we need to sort of connect with people for shared decision making and customized care based on their lifestyle. And it brings us into our own biases, right? As members of the healthcare community, and then institutions. So the whole idea that was just, and our health, or Northwell Health just signed on, that racism is definitely a public health crisis, and that bias, racism, institutional racism, all of these factors affect our healthcare delivery model and affect our patients' ability to truly adhere to a medical regimen need to be factored in. We are human beings in the medical society. We are formed and act based on our lived experience, and stereotyping comes into play. And so recognizing we all have biases, but we can mitigate bias by just hitting the pause button. It's not a negative thing, but turning bias, recognizing it, recognizing how we're treating our patients if they speak a different language, making sure, or a preferred language, that communication, that we take the time to get our interpreter to communicate, to understand what matters to them, and how we can co-create a treatment strategy is truly important. So it's a journey. I say that the work of cultural competency, disparities, diversity in healthcare is like climbing Mount Everest. And every once in a while, you think you have made it up to the first or second summit, you get kicked back down, and you have to start again, build an army of people. We're all in this together, but also changing structures, changing how we teach in medical school, expanding the curriculum to include cultural competency, health literacy, bias, things that contribute to health inequities have to be included, not only for medical school, nursing school, all areas of healthcare.
Yeah, I think it's definitely really important. And like you said, it's always a battle and this challenge, but it seems like you've really seen a lot in your lifetime, and hopefully that things are changing and, for the better. So I want to ask about that you're a co-chair of the President's Working Group on Diversity and Inclusion at Bennington. How is that kind of bringing your expertise back to Bennington?
So, I had been a little bit disconnected from Bennington for many years, just because that's how life got in the way, right? But it was always part of who shaped, the Bennington way, shaping who I am, informing how I make decisions, sort of in the, subliminal effect. But always following along what was going on. And when President Laura Walker called and said, would I consider this? And I had met before with the interim president, Elizabeth LaRoche, just in terms of reconnecting with Bennington. And so it was, even though my schedule is crazy, I felt that this was an important committee and working group to be part of, and maybe I could bring my journey and expertise, of being in the Chief Diversity and Inclusion Officer at Northwell for 10 years, to really add that I can make a contribution in this effort and noble cause, needed cause, to foster the Bennington platform as being anti-racist and truly foster inclusion. Because I think at the end of the day, all of these components all will make for a much more inclusive sort of educational Bennington platform, right? And it needs to be across. We need, as a society, to sort of connect as humans, reignite humanism, and foster inclusion, embrace differences, and recognize that diversity in all aspects, whether it's sex, gender, job-wise, racial and ethnic, language, geography, all contributes to innovation, right? And so it was truly an honor to join and be asked and be included in the President's Working Group.
Yeah, I think it's really important to have your voice. I'm sure a lot of people are really interested in hearing what you have to say, seeing all the things that you've done in this lifetime. I just want to hear some advice that you might have for me as a young person who's interested in becoming a physician. What kind of advice do you have for me, especially as a woman myself?
So before I get to that, I just want to talk about the great thing about what I'm learning about the President Working Group. All the people that have volunteered each bring their own unique perspective. And it's interesting, after every meeting, we all learn so much from each other and different viewpoints. So it goes back to the Bennington way. You have this diverse group of people on the President's Working Group bringing amazing ideas. And there are many Bennington students on the group. So for me, it's always fascinating to hear the students' perspective, their lived experience, some of the faculty, as well as some of the alumni that are on the working group. So it's really amazing. And so we're learning from each other and leaving and coming up with solutions. So, and we're also learning, and this is one thing I think about leadership, the sort of humble leadership model, the ability to be agile, the ability to be a lifelong learner, the ability to sort of come back, as a starting point, truly, truly important. So coming back to your question, I think, it's an exciting time to be going into medicine. I think medicine offers, first of all, it's such if you're passionate about it, it's a rewarding profession, the ability to make a difference, touch lives in multiple ways. And you can think of touching one life at a time, in your own specialty, in the clinical world, or there are now avenues to be in healthcare leadership, to teach new students. So myriad, to do community health, outreach to your community. So I feel that it is an exciting journey. There will be, obstacles along the way, but importantly, I would say develop a group of friends, colleagues with shared vision, who will be your sort of autograph to help you in challenging times. And finding mentors along the way. And in medicine, where now I know in cardiology, formalizing a mentorship program will definitely be helpful. Recognizing your limitations, not being afraid when you don't know something to say, oh my gosh, I don't know, and finding help. And it's so much easier now than when I was in medical school to have access to information, right? I mean, you probably don't even know what it's like to go to the library. You have to look up things, pull stuff. Everything is so easily accessible, right? So that is huge. But I think that you will find that in medicine, along the way, people are willing to help. As you become a physician, recognize when you're on call that respect and honor the contribution of a lot of people, of different people on the healthcare team. The nurses, so the patient is really your most important, the most important person on that team, right? And everybody is working in addition with the patient being part of the healthcare team, that everybody brings knowledge, that everybody has shared vision in improving the life of the patient, that everybody has something to contribute. So respecting that the nurse will have information, that it's important, that it's a team approach is so important. The person who's delivering food to your patient, because people connect with patients, will have information so that we're all in this together, I think is important. And when I was in training, your medicine, and it's still paternalistic, right? It was, it was survival of the fittest. You finish your medicine, you're the doctor, you're that sort of godlike complex that was written about, could lead to lots of not getting adequate information. And it's not the ideal way to improve patient outcomes. So medicine is a team sport. And once you recognize that you can get a lot of information, that we're all in this together, is truly, truly important. Every single person has something to contribute, and you have to honor that and respect that. And have fun along the way, right? I mean, I think, finding time to laugh, finding time to reflect, truly taking time, first of all, to take care of yourself, recognizing that you don't know everything, asking for help, truly important, and finding time to have some fun and laughter, truly, truly important. But there are so many opportunities right now, and so many different areas of medicine to be explored than the traditional way of seeing one patient at a time, that I think, spending time to find your passion and find which avenue or blend or hybrid model works for you is so important. But it's a great time, I think, to be entering healthcare and medicine, as long as it's your passion.
Yes, it is definitely my passion, and I think I've met like some of the best people that I've ever met in healthcare, and it always amazes me. Like you said, everyone has something to contribute, and the nurses, the doctors, even the people at the front desk. I mean, there's always someone. They always have something to contribute to the team effort thing.
And yeah, and as you go along, you'll always remember that, and coming back to your question you asked about, my personal success or whatever, recognizing that we stand on the shoulders of so many people who have paved the path for us, acknowledging that, honoring that, I think is also important, and then paying it forward is truly, truly important. I mean, Maya Angelou, the great Maya Angelou, said, we are here because someone loved us, someone sacrificed for us, someone gave us a chance, and we should always honor that. And it's the we and not the I that's really important. We're in this together.
For sure.
And I'm standing by to help you in any way that I can, whether it's vetting advice about which school you should go to or what works for you. So consider me, a partner on your journey to medical school and beyond.
Thank you so much, Dr. Mieres. It's been really a pleasure to speak with you, and hearing about your journey is super inspirational. I think I'm really grateful to be at Bennington. I mean, aside from you, I've also met a lot of people who, they've taught me a lot of things, and all the mentorship, and also just meeting a lot of people from all different walks of life. I think that's definitely what I've seen at Bennington, and you're definitely also an example of that, a really great example of that. So that really is all the questions I have for today, but thank you so much for your time and sharing your story.
Truly, truly a pleasure and an honor. And remember, in medicine, even in medicine and throughout life, the power of storytelling has the ability to connect us, to sort of reignite that humanism that we all have. And so tell stories and share stories. And I think that's part of the Bennington way.
Yes.
It truly, truly an honor and pleasure, and standing by to help at any point in time.
Dr. Mieres, this award has been presented to you for exemplary leadership. Is there something that you want to speak about or say to your sponsors for this?
Well, I truly honored to be selected and join many of the honorees in past years who have received the Elizabeth Coleman Visionary Leadership Award. And I want to say a heartfelt thanks to all of the donors for this award, as well as the trustees and the alumni at Bennington. And I think, as I reflect as an alumni myself of Bennington, giving back making sure the amazing creativity and the Bennington education, the Bennington style exists is so important. So my heartfelt thanks to the donors, to the trustees, to the alumni, and to everyone, the staff and faculty at Bennington College. And I think that as we enter this sort of new era, the post-COVID era, where we have learned a lot, the Bennington way of life, the Bennington education is ever so more relevant. So continued sponsorship, donorship, and everything is definitely, and engagement of alumni is very important for us to continue. So I thank the donors, the sponsors, the alumni, and the entire team and faculty at Bennington College.
Thank you so much.
Thank you.